October is Breast Cancer Awareness Month, and I am pleased to welcome Dr. Lori Medeiros, the Medical Director for Rochester General Breast Center, to the show. Great to have you here, Doctor.
Thanks for having me on.
In part one of our conversation on breast cancer, we talked about screening. Today I want to kind of advance that and talk about diagnosis, treatments, and recovery as well. Where should we begin with diagnosis?
That's a lot to get into a little spot, but you know, I think one of the things that I like to emphasize to people when you're newly diagnosed is, you know, it's a heart-stopping moment. So you really want to take a time to, you know, just take a breath and realize that breast cancer treatment, diagnosis, this has all come a long way. So technology is better, treatments are better, outcomes are better. So that's really positive. You've got a lot on your side. Really important at the beginning to touch base with your family doc or your trusted regular provider, because you really want to get their input into how this kind of unfolds. And then you do want to come in and see a surgeon relatively quickly. But by quickly, I'm not talking about days. You know, we can breathe a little bit around that. Early diagnosis and early treatment really references a period of a few weeks generally that we're talking about. So within a week or two, you know, is probably fine. And it does allow some of the early anxiety to kind of come down. We make it a point in the breast center trying to get people in within 72 hours because sometimes that's not always easy for people, but it is something to bear in mind because that urgency is always kind of there.
Talk about the process of putting a treatment plan together,
sure, and then
the recovery from that as well as the patient goes through.
Yeah. So, you know, the initial visit is generally, you know, you're really looking at about an hour and a half or so of conversation and personalized notes, that kind of thing. Really, it's important to kind of understand that you're not expected to understand everything about breast cancer before you walk in, you know, and so people sometimes are overwhelmed with this idea that they need to do all of their research and really understand every aspect, and it's a big field, you know, and that can be really overwhelming. So while I think it's good to kind of delve a little bit into things before you walk in, it's not necessary, and I think the important things that you want to take away is what's the first steps, what's my diagnosis, what's my stage, and what are my options really, because sometimes people walk in with a real preconceived notion of, you know, what the right thing to do is, and sometimes just hearing, you know, about different options may or may not change your mind about what's right for you. So I think it's really important in that first visit to understand that while you're getting a lot of information, really what we're trying to provide is kind of an aerial view of what's coming down the road. And you're going to be hearing the same things over and over as we move along through the process. And I think that's reassuring for a lot of women. The other thing I really advise is if you've got somebody who's a good note taker, bring them along. We certainly provide written notes when we're in the room. But sometimes it always helps to have another set of ears because, you know, I think you're already overwhelmed. This is already very foreign to most women, and I think just having that extra set of ears that you can bounce things back up after the visit is helpful, and somebody who understands your mode of thinking and your point of view.
We'll leave it there, Doctor. Yeah. Thank you. Appreciate it. More information can be found online at rochesterregional.org. Search for Breast Center when you go online there.